Welcome, everyone. My name is Ed Condon, and I'm the Executive Director of the Region 9 Head Start Association. Amongst the variety of activities we do here at Region 9, one of the activities we enjoy the most is our Innovations webinar series. It's when we hear from a grantee within Region 9 about exciting accomplishments, activities, projects that they've taken on as an opportunity to learn from your peers, to hear their strategies, and to consider how that might apply to your operations. We've had a number of webinars in the past, and today we're excited to bring forward Acelero Learning of Nevada County. Acelero Learning's mission is to bring a relentless focus on positive family and child outcomes to close the achievement gap, and to build a better future for children, families, and communities served by their Head Start program. Acelero Learning has been serving Clark County since 2008. In addition to Clark County, Nevada, Acelero Learning delivers Head Start and Early Head Start services in the communities in New Jersey, Pennsylvania, and Wisconsin. Under the leadership of Dr. Michael Maxwell since 2020, Acelero in Clark County operates 13 early childhood education centers across Las Vegas, North Las Vegas, and Henderson. Dr. Maxwell has an extensive history in youth development, school collaborations, and previously a pre-K and kindergarten teacher. Please welcome Dr. Michael Maxwell and his team from Acelero Learning. Dr. Maxwell?
All right, thanks, Ed. It's great to be here with you and Region 9 members. And I'm glad to definitely be here with our leadership team from Acelero Clark County. And I look forward to our conversation today.
Wonderful. Would you like to jump in and give us a simple overview of the report, and then we can jump into questions?
Sure. I think I have some light coming in. There we go. Maybe over there. So the Annenberg study from Brown University gave us some insight on outcomes that we were able to show gains during the pandemic. And this is quite outstanding because we had studies that basically said during the pandemic, don't expect any educational gains among children. And that's both for pre-K up through K through 12. And the Annenberg study actually showed that we made gains, our children made learning gains, both in our virtual and our center-based operations. And so we were really happy to, about the results from the study. And today we're looking forward to sharing some of the things that made it possible to achieve those gains.
Wonderful. Dr. Maxwell, do you want to do a brief introduction of your team here so that folks know who's all on the call?
Yeah, sure. My team knows that I don't like to speak for them. So if we could just go across the board, I'll call out and then you guys will just introduce yourselves. And I will go according to who I see on my screen. So Diana, would you go first?
Yes. Good morning. My name is Diana Ferrari. I'm the Director of Health and Nutrition with Acelero Learning. I started with Acelero in 2008, but worked for the previous grantee.
All right, and then Amanda.
Good morning. My name is Amanda Loyola. I'm a health coordinator here with Acelero Learning Clark County, and I have been with Acelero since 2012.
Thanks, Amanda. Shannon.
Hey, I'm Shannon Lazarchak. I'm the Human Resources Business Partner here, and I've been with the company for 12 years now.
Yvonne.
Hello, everyone. I'm Yvonne Jacob, the Director of Education, Disabilities, and Mental Health, and I've been with Acelero Learning for 11 years.
Okay, Julie.
Good morning, everyone. My name is Julie Dominguez. I am the Director of Extended Services, and I've been with Acelero for 12 years as well.
Thank you. Dale?
Good morning, Dale Furukawa. I'm the Director of Operations Monitoring and Compliance, and I too have been with Acelero for 13 years. Good to see everyone.
Amber?
Good morning. I am Amber Earley, the Director of Monitoring, Compliance, and Analysis, and I have been with Acelero for 8 years.
Deborah?
Good morning. My name is Deborah Payne. I'm the Executive Assistant. I've been with Acelero Learning since 2008.
All right. Rose?
Yes, good morning. I'm Rose Collins. I'm the Director of Family Services, and I've been with Acelero since 2008.
And last but definitely not least, Kellen.
Yes, I am Kellen Augustine, the Director of Finance for Acelero Learning Clark County, and I am the new guy. Everybody's got years under their belt. I have months under mine. A full 8 months I've been with Acelero, loving every minute of it.
All right, thanks, Kellen. And that rounds out our leadership team and everybody that's on this call today.
Oh, quite a wealth of experience. Wonderful to see you all. Thank you for your time in advance and for your willingness to share these results. So Dr. Maxwell, Alejandra has put in the chat a copy to the publication if folks are wanting to pull that up so that they can work along with us here. We have sort of a variety of questions to ask and want to welcome the folks. There are about 30 of us on the call who are listening in as well, to encourage them to post questions on the report or other questions that sort of come up as we go. And as you said, the past year or so has been one of challenge, one of lower expectations has been sort of the tone, and one of do what you can do the best that you can do. And clearly this report points out that in your service area, you not only did the best you could do, but you actually achieved some gains, and children continued making progress toward that goal of school readiness. So congratulations on that. And really, I guess, as you sit here today in November of 2021 and do the usual planning forward, thinking of budgeting and thinking of staffing and enrollment strategies in the new year, and your team reflects on the outcomes of this report, what aspects are you most proud of? And what has changed in your strategies as an agency, just at that 10,000 foot level? What are you doing different now that you wouldn't have done or foreseen you'd be doing a year ago?
Well, I think to start, we're proud. We're very proud of the gains that we showed in the report. But to make those gains possible, we have our team right in front of us on this call, but the fact that our 300 plus team at Acelero Clark County is what I'm really proud of, because that team, especially our classroom and our center teams, they remain zeroed in on our mission, which you read at the beginning. And our mission really is focused on positive child and family outcomes. And so they stayed, our entire team stayed zeroed in on that mission, but then also on our priorities of health and safety, family engagement, and child learning. And I think that's the most proudful thing most thing that I am proudful of to come out of the report. Not only the gains, but what it took to make those things possible. And everybody on this call right now, along with that 300 plus members of our team, made that possible. I wish they could all be on this call right now. But I'm sure we would have, there's no way we could do that with so many of us, but that's what I'm most proud of. And then also, in addition to supporting our center and virtual operations that we had during the previous year, our leadership team considered the holistic needs of not only our children and their families, but then also the health and wellness of our staff. And I think that's something that makes us somewhat special, is we really thought about what can we do for our staff. Of course, we would have loved to have just paid everybody, you know, a much greater amount, but we tried to do what we could as far as considering health and wellness and supporting our staff. So that's another thing that I'm really proud of. One of the things that I think we will continue is, and we have continued, is definitely looking at how we use technology to support not only our children's learning, but how we support families and reach out to families and maintain that communication. One of the things that we did was a survey often with families, and we've continued that to survey families as far as what are their needs. We've communicated with families with things that we are doing as an organization in support of their children's learning. And so those are two of the things that we're really continuing, is that communication, but then using technology to maintain that communication and extend that communication. So we're always looking at what else can we do to make sure that everyone is in line with what we're doing and know what we're doing as an organization. And I think it would be helpful at this point to ask the leadership team certain things that they did that contributed to supporting our children and our centers and virtual operations. So at this time, anybody can just chime in and share what your department specifically did to support.
I'll share, Dr. Maxwell. So when the pandemic first started, we had to quickly mobilize the team to contact families immediately. And in order to do that, we had to ensure that the staff had the equipment and the tools that they need to make this a success. So when the first week we closed, we contacted 94% of our families to just assess their needs as far as the internet, books and things that they needed in home in order to make the virtual learning a success. So we contacted families daily. We held meetings daily. We did virtual communication with staff, and then we did cross collaboration with education and family services, just in case a family contacted the teacher and not the family advocate. And we also work closely with health and nutrition.
So as far as health and nutrition, children can only learn when their basic needs are met. That includes health, nutrition, and safety. For the children that attended in person, we were able to complete one classroom a day doing health screenings until the staff were able to get their vaccinations. Along with that, for our virtual children, we scheduled home visits to complete them, and we invited them to our food distributions. UNLV School of Dental Medicine was really helpful in our making sure their dental health was taken care of. They set tables outside of each of our centers and provided exams and fluoride treatments and referred them and made sure that the families were able to access any follow-up care. We have a good partnership with Bamboo Clinic, and they were able to provide physicals and well baby checks because some of the medical providers were not doing in-person services. And then of course our food service was able to provide the CACFP meals for our virtual children. First, they started with giving them out at food distributions. Then we were able to set up a schedule for them to deliver them to the families' homes. And Amanda is going to tell us a few more additional things that we were able to do.
Thanks, Diana. In addition to that, our nutrition coordinator was able to continue to work with our local food bank, 3 Square, to reopen our food distributions at 3 of our locations. And we not only serviced our families, but we also opened up those food distributions to the community. Along with that, we were able to deliver monthly supplies of formula to our EHS children, baby food, and any diapering supplies they might need each month to all of the families in the virtual program. We also set up hot food deliveries to any of our families who tested positive for COVID. That way, if they were unable to go out and obtain what they needed, we were able to support them in that. We continue to assist families over the phone with online insurance applications. And we increased our community partners, which included Immunize Nevada, and were able to participate in pop-up COVID vaccine clinics at our food distributions to offer the vaccine to our staff, to our families, and to the community. Our insurance providers also volunteered during the food distributions to not only assist the families in applying for insurance benefits, but to also assist with the food distributions themselves. And we also have a new partnership with Beech Tree Diagnostics, and they are currently providing on-site COVID testing 4 days a week to our staff, our children, and the families. Okay.
I'll go ahead and piggyback on what Diana and Amanda also shared. During this time, during the pandemic, we realized that while we opened up some food distribution sites, we realized that we really need to take the food to the families. So with Amber Earley's data team, we were able to identify the best routes to be able to deliver food to our families. And with the Nevada Department of Education CACFP waivers that were approved, we were able to deliver meals, 3 meals a day, which is breakfast, lunch, and snacks. And it was for an entire week. So that was 7 days of food that they would normally not have received, even if they were in our centers. So I believe it definitely was a community effort, and it took this team to make it happen. Amber?
Yeah, thanks, Dale. So as the data person from the beginning of the pandemic, even to currently, we just had to constantly look at new innovation around even how we were reporting and tracking some of this information. And as Dale said, we actually started creating routes for our drivers to most efficiently deliver the food to families. And then, you know, all this cross collaboration required just different systems than like a Child Plus and what we use, Shine Insight. So trying to create forms and reporting to have transparency within our delegate. And then, as Dr. Maxwell mentioned, really just getting creative with how we were communicating with families and sharing information as well. And we actually started using Remind, you know, very similar to Class Dojo. We weren't doing those things beforehand. And that's been something that we have since stayed with, and our parents appreciate, again, trying to create that transparency as they're not physically in the centers as they used to be. Then this gives them a lens into their child's day. So yeah, that's from the data piece. And then as they touched on from the compliance piece, is just making sure we have healthy, safe environments for our families and our children to come to every day, which includes the safety of our employees. They talked a lot about, which I think is unique with us, is we do have vaccination clinics on site, COVID screeners on site. So complying with licensing and local regulatory bodies, but also, again, just making sure our families and children are learning and employees are in safe environments. So I think Shannon can probably add more to the employee side.
Yeah, so throughout the pandemic, I mean, of course, we weren't expecting to close down on the day we closed down. Had to create a lot of policies, put a lot of things in place throughout the entire time. And we also made sure to constantly be checking in and doing surveys with our staff just to find out how they were doing. You know, being quarantined at home, and suddenly parents are working but also have children at home that are trying to do schooling, and it was really difficult on staff. I mean, I think everybody understands that, but we did a good job, I think, of checking in on them, surveying to ask what they need. Do they have the technology they need to even be able to do their work? Did they need anything? Emotional support. We made sure to have our EAP available. We all got very acclimated on Zoom and doing team builders on Zoom and just trying to really be able to connect with each other since we weren't there in person.
And for the education side, as the rest of the team stated, they were on the ground running. The education side, we were training staff on the shift from teaching in the classroom to virtual, and then also making sure that we were ready for children that were coming back into our center-based classrooms. So there was a lot of training that went on for staff on how to teach children virtually, checking in with families, adding to kind of like the technology piece. We were actively at these food distributions, distributing tablets or technology that was needed with families, giving them tutorials, quick tutorials of how to utilize the materials, meeting with families daily, providing virtual learning services, as well as like introduction to other technology platforms such as Epic Books, Khan Academy Kids, and then also along with what Amber was saying, the utilization of Remind. So really training teachers around that and on how to communicate with their families through there and keep in touch with their families and share any relevant information that families needed to have.
Then for extended day, what happened is our governor actually shut down all the schools, but because Acelero Learning had a childcare subsidized program, we were able to be essential workers. The governor stated that only essential workers were to remain open. So what we did is we identified all the families who were essential workers and provided services to those families. And on the subsidized program, something that wasn't done before, our families were able to obtain a dual subsidy. So if they were in our program and they still needed additional services or they weren't able to come in while we were trying to slowly open up our centers, they were able to go to another provider and still keep their subsidy with Acelero until we opened up the center that they were assigned to, that the preferred center. So that was something that was done before, and that wasn't done before. That was done during our time while we were closed. And it really did help our families.
And what made all of this possible, besides the brilliant minds on our team at Acelero, were some additional funding sources we received strictly because of the pandemic. CARES Act funding, CARISA Act funding, and ARP funding supplemented our efforts in order to buy additional things like delivering those virtual meals, putting a third teacher in classrooms to limit social distancing, keep those family units intact. We bought additional sanitizing services, PPE supplies, and we were able to offer an additional wage to our staff through our fearless pay incentives. Last, somewhat personally, financially, we realized the capabilities of working from home. I think prior to pandemic restrictions, if you would have asked me if someone was working from home, they were probably laying at the pool all day. After the pandemic, I think we've proven that we're more than capable and more than efficient working at home, just as we are in the office.
Just to speak to our policy committee and board engagement, we were able to maintain that during virtual meetings every month with them to make sure that we were getting everything approved, that we need to get approved, all the budgets, the grant monies that Kellen mentioned, to get all that stuff approved and allocated to the right places. And also for the annual training, for the services or the trainings that we have to or required to present to our families, like child abuse and neglect, URSEA, shared governance, school ready, those type of things. What we did this year or last year, we created videos and sent those videos out to the parents that they can review them in their own time. And to make sure if they had any questions or anything. We also this year included a data culture training for the parents, because we have lots of data, like Amber mentioned, we have lots of data, and throughout this pandemic, we had to come up with other creative ways, which included data to read. So we included those trainings in that annual PC meeting as well, so that our parents would know how to read those data. And just complete involvement throughout the entire year. We had quorum at every meeting, so it was good for them too.
Ed, I think you can see why I wanted to have our team on for this call, because yeah, the report tells a story in itself, but it's behind the scenes. It's what took place to support our kids. That was really important. All the stuff that we just listed was taking place, and so again, I think that shows you why I wanted this team to explain all of the things that took place in addition to what was going on in the classroom.
And it really speaks volumes to the culture of your organization to get it done and do it with that excellence. A couple of questions have popped in. I just want to begin the questions by just thinking for a moment that so much of this work that was designed became public in the hands of teaching staff who also, and family services, were also scared and navigating COVID themselves. So congratulations on bolstering and providing them that support so they could do the work, the delivery, whether it's the technology or the food or the other services that parents actually saw. But so much was going on in the background. In the report, there's quite a bit of involvement by parents. And the first question is, how did you get your parents to participate in the study at a time where they were so busy and maybe reluctant to do more? What was the strategy to get that level of engagement?
Yvonne or Rose, do you want to take that?
Ed, could you repeat that? My internet cut out when you were reading the question. Sorry.
Mine's too.
No problem. And the question up in the question box is, how did it come about that your agency participated in this study? I misspoke, actually. I thought it said parents participating, but it was about the agency participating.
So then I can actually go into explaining about the agency. A couple of years ago, Acelero was recognized in an article that was written about what Acelero has been doing in the world of Head Start. And that led to Brown University reaching out to Acelero Inc. to conduct a study. And so, of course, once the arrangements were made, then it was a matter of looking at, okay, do they want to get participation from all 4 of the delegates versus looking at one of the Acelero delegates? And so the decision was made to look across the delegates, all 4. And so it was very easy for us. Basically, we heard from the network that the study was going to take place, and then it was a matter of how would it go from there as far as the methodology and so forth.
Excellent. And the second question that's popped up so far is specific, and you can see it in the Q&A, specific from Rick Moncler, how curious, he's curious on how the gains of 2021 year compared to prior pre-COVID school years. And have you been able to look at any longitudinal comparisons?
All right. Yvonne or Amber?
I think we looked at gains a little bit differently this particular year, and we're just, like Dr. Maxwell stated earlier, just surprised to see any gains in general. But I think that is going to happen going forward, especially as some of those same children are now going to be with us maybe that additional year. We have also been lucky enough to partner with our local school district. So those children that may now be in kindergarten from last year, I think we will have the opportunity in the next few years to also see how well they do now that they are in kindergarten. So a little bit of all of it. Acelero does do comparisons year over year, but it will look a little bit differently, we know, this year and into next. So excited to see what happens to our returning children and then what the outcomes can be for our children that are currently in kindergarten.
I'd also add that you know, looking, and I really appreciate that question as far as longitudinal comparison. One of the things that we have done is all of our kids are now in the early learning district in a statewide data system. And so because our children are included in that, we'll be able to follow the progress of our students all the way through to graduation from high school. So I'm looking forward to, as Amber said, things were, you know, the data was a little bit different in what was collected before, but now we will be able to, moving forward, to continue with this, with our children from last year and be able to watch their progress all the way through to graduation from high school.
So one other aspect I noted in my review of the report was that you utilized Lena as a tool to document language interactions. What strategies are you utilizing with teachers now and other staff to understand the implications of the findings? There was quite a bit of detail drawn out of the use of Lena. And do you see that going forward as a strategy, both in professional development of staff as well as supporting parent engagement?
Well, the Lena jackets or recording units were for early Head Start, but I think that we were able to see from you know, the reports that we got from Lena, those would also have an effect on our Head Start classrooms too. Basically just best practices across the board as far as communication with children. And so Yvonne, I think, can really share some of the things that we gained or learned from that.
Thank you, Dr. Maxwell. Yes, so with Lena, you know, we utilize a lot of our findings. We dig into the data with our teachers. So what we do at a top level is we go through the specific data and we look at it at a delegate level, and then we look at it at a center level and how we can best support teachers in improving their conversational turns and interactions with children. So it's really having professional learning communities with our teachers, having our teachers look at their individual data for their classroom and their children, alongside with their center director to really see, like, what are these areas in language that I need to work on with my children in my classroom. And so from there, teachers plan out individualized learning plans. The center directors work with teachers to really develop a plan for coaching to see, like, what areas do I need to improve or what areas do I need more support in to increase my conversations in the classroom with children. So really working as a collaborative unit with myself, the early learning inclusion specialists, the center directors, and the teachers, as well as the families. And during our parent-teacher conferences, home visits, we share this information with our families. We've also started doing, having our parents take the Lena Vest recordings home, and then also recording the parents' conversational turns with their children and helping the parents realize and understand the areas where they can also improve to help their child increase their language and conversations.
Other thoughts on that, or should we move along?
I think we could move along. I mean, Lena is a technology, again, that just, I wish we would have had it, you know, decades ago, but Lena is a technology that allows, you know, an unintrusive recording of the interactions between children and adults. And so I think it's just a great technology. And again, as we said toward the opening, you know, technology is one of those things that we're looking at. How can we make use of it to continue with some of the gains that we've made or we showed last year?
So in the report, I noticed there was references to children who were unable to continue participating in the study And so that was with a withdrawal. I'm curious to hear, as you look at last year and your efforts to engage parents to continue the programming for the benefits of a study or just the benefits of Head Start and Early Head Start in general, are you finding new strategies in this time as we go into the next year that you're deploying to increase attendance, to increase parents stay throughout the year and regularly attend? Have there been some lessons that this report served up or you've learned in this past period about attendance and regularizing that?
Yeah, definitely. There are a couple of things that we want to talk about here. And so I will look to Rose to talk about some of the things that we've done, but then also to Kellen, if you would talk about sort of the business case that we have talked about recently, which is an outcome from what we saw during the well, it's still going on during the pandemic, but we've also talked about a business case for looking at why we need to keep children in the classroom. So we'll start with Rose and then go to Kellen.
Yeah, so what we do, we have multiple strategies that we utilize, but one of the strategies in particular is the virtual intake process, where we try to build a relationship with the parent and the advocate. So if it does come to a place where they might be thinking or a situation come up where they may have to withdraw their child from the program, what we do, we deplete and exhaust all strategies and possibilities before that happens. So just building a relationship between the advocate and the parent before it gets to that outcome. So that's one of the strategies that we're using this year.
As far as the business case is concerned, I think the most evident one is if we don't have full enrollment or we have less children in the classrooms, our reimbursements are less. CACFP meal reimbursements are not as high as we would have budgeted, and our state funding sources will not supply us with as much funding if we're not fully enrolled in those programs. And I think in addition to that, Dr. Maxwell, let me know if I don't touch specifically on what you were referring to, but we've been really trying as a leadership team and as an Acelero team in general, getting our name out into the community more. Attending centers, showing our faces, showing we care, and getting our Acelero name out in the community, either through paid advertising sources or through unpaid events through our community partners.
And just in addition to that, I would say that, you know, one of the things that we're developing and will be developing over this year is, when I say the business case, I'm talking about the investment that's made into every child that enrolls in our program, and looking at especially the early investment, because we have to do all of those screenings. Our family services has to reach out, make so much contact with parents and so forth. There's a lot that goes into getting families enrolled and getting them settled during that first 90 days. And the last thing that I want to see is we make that investment in our children, our staff spend so much time on that child and with the parents, and then they leave. And so what I've asked Kellen and his team to do is look at what are the financial costs. So that's what I mean by the business case. What are the financial costs when a child walks out the door within the first 90 days of the program versus when a child leaves, you know, or is disenrolled, you know, 8 months down the road, so that we can always see, we know that there's a cost, but what are the costs during that early period versus later on in the year? And with that, we want to use that to drive the extent that we go through. And Rose pointed out, you know, it's almost exhausting, you know, to try to reach out to families and do all that we can to make sure that they stay. But now we'll also have a number, a dollar amount that we can put on it that will drive us to say, hey, we don't want to lose that investment. We are here for the child and for their families, and we want to keep them with us throughout the entirety of their time with us until they turn 5 years old. And matriculate into K-12. So that's why it's super important for us to keep children in the program. It's not just, during the pandemic, but we spent a lot of time and effort and dollars, even though it's at no cost to the family. Those dollars are dollars from taxpayers. And we want to be able to show that we are taking every dollar we put into a child and their family. We're doing everything that we can to keep them in the program so those dollars are not wasted.
And just to add to that, Dr. Maxwell, I think with that information, it'll give buy-in to all staff to help and support on retaining children into the program.
Yeah.
One question that popped into the, sorry.
I just wanted to add on to that
Please.
also, to make parents feel more welcome and involved in our centers. Because of COVID, we've had to go to virtual meetings. So like our family engagement meetings, we have small groups with our families to keep them more engaged with our program.
Thank you, Diane. And that's a good segue into the question that popped up from the chat, and was, what changes have you made to your facilities to accommodate some of these transitions, such as virtual services offered by staff, or making parents feel more engaged and more safe, considering that COVID continues with us as we go forward? Are you making changes specifically to the center's physical plans?
Both Yvonne and I can jump into this, as well as the rest of the leadership team. Prior to looking at reopening our centers, the leadership team actually physically walked the buildings to identify any potential areas of concern for any families that may be visiting. So we really provided social distancing markers. We actually were able to identify locations where parents could literally drop off children directly at the doors of our centers versus at the walking through the building themselves. So we didn't have a lot of families in our buildings. They literally dropped off their child at the door, which actually allowed for more one-on-one engagement with that family along with the teaching team, and it made it a lot easier for us. And we actually continue that same method of drop-off for our families as well. I believe the families who actually prior to coming to the centers, they previewed videos of what that would look like. So before they actually walked into the building, we actually showed them what you'll expect when you come to our centers now. And then we indicated to them that the safety of them, as well as our staff and our children, were predominant. So we indicated to them that we will provide all the PPE necessary, whether it be additional disposable face masks. We provided actual face masks for all the children in our program. We still do that today. Nothing that we ask of our children or our families, they have to bring to the program. We provide everything for them, and we continue to do that. And I know Yvonne and her team actually worked on so many different training modules, and they continue to do that today. But I'll ask Yvonne to join us to tell us what that continues to look like.
Thank you, Dale. In regards to education and just the teachers in general, they did such a great job in their environments of removing items, that would potentially spread disease. So we did partner with our local quality rating improvement system. One of their coaches conducted a webinar where they trained us on things that are acceptable that would still fall in those specific quality rating indicators, what to remove, how to substitute it for something else to ensure that children still their needs are still being met. And definitely the times have changed, but the needs of our children are still the same. So we were able to in the beginning, we did a third teacher in the classroom to help with kind of cleaning, sanitation. We had lower ratios at first to get our teachers acclimated to kind of like this new way of teaching, new way of conducting their classrooms. Since then, we've added we went to our full enrollment. Teachers were able to acclimate. We slowly enrolled children into classrooms so that teachers were able to get used to that again. So there was a lot of changes to environments, also to outdoor play. Outdoor play, we limited outdoor play to one classroom at a time to alleviate from those cross-contamination, just to help with social distancing as well, providing our teachers with individual carts for outdoor toys so that, there wouldn't be that period of where they had to clean it for the next classroom. So each classroom had their own cart of toys that they were able to bring out and utilize. So that's what we did.
Wonderful. Just one more question from the report that I noted, that just executive functioning increases were noted in center-based students more than in the virtual services, the students who receive that. I'm wondering what accommodations or what changes you might make in how you provide virtual services to bring those more in line, or is that possible? Can we look to virtual services to be as rich and as supportive in that particular area of development, which we know is so essential as a part of early childhood?
I think there's going to always be a challenge as far as virtual services equating to the same engagement and quality that you get in the center. Plus, I think with the center, you also have the social aspect of other children, to be able to see, when another child is participating in this manner and gets praised. That automatically has an impact on the other students, because then they want to look for that praise versus being at home and they're by themselves. But the one thing that, during the pandemic, we had to go into response mode and offer virtual services. But now that we've gotten back to full enrollment, we no longer offer virtual services unless, we have a closure of a classroom or of a center. So that really is a very temporary response versus what we offered last year, where we actually had virtual service. It was the parent's choice to receive virtual services throughout the entire year. This year, we no longer offer virtual services except for, as I mentioned, in the case of a temporary quarantining or closing down of a classroom or a center. And so some of the things, though, that we take away from virtual is, again, just that trying to make sure that we have the utmost communication and engagement with parents so that they're still reinforcing the gains that are made in the classroom. They're reinforcing things at home by reading to their children, participating, using our peer cards that we provide to parents for family engagement. And so we're just constantly looking at what else can we do to make sure what's going on at home supports the learning that's going on in the centers.
Wonderful. So I want to move us to a wrap up and maybe invite each one of you just to share out. And really the question is, as we go forward, knowing the report was examining school readiness growth and given the excellent outcomes that were demonstrated there, what strategies will you adopt and scale up even as you go forward from your differing perspectives? What's stuck with you really want to hold on to and even accelerate as we go into the next year? Invite anyone and everyone to share out thoughts.
Well, I'll share out. I think with our robust family engagement model that we have in place, to continue with that and enhance it, of course. And we know parents have input, so always keep that in focus. Everything should be family driven. And I think that's why the outcome was what it is, because we did focus on the family and the parents, and we took their inputs into consideration.
And I would just say
I-
our community partners, just to continue to grow more community partners to provide services for our children and families in the community. I know we have a lot that have to do with the health and nutrition, but we also have community partners that are willing to donate coats and everything else for us to provide for our families so that they can stay healthy and safe.
I think for the health and safety side, continuing on that same vein, I think one of the lessons learned is that we should not and cannot pull back on any of the health and safety measures that we've implemented. And that's something that is going to continue within our program, whether it be, the heightened electrostatic spraying, heightened cleaning within our buildings, the providing of the additional disinfectant needs. I think it's something that we are going to continue even as, COVID continues, as the flu season comes on, et cetera. So it's something that we will definitely envelop as part of our program moving forward.
From the data side, I'm excited to look at data differently, to continue to innovate on what we share and what we look at and how we analyze some of that data to continuously improve on our processes that ultimately improve the quality and outcomes of what our family and children experience.
And on the education side, we made a shift during the pandemic to focus our coaching on foundational teaching practices for our teachers. So really helping teachers build that foundation so that we can build even more and make sure that our teachers are prepared to teach our children.
And I would definitely say, as our board, utilizing our stakeholders and the influence that they have in our community, they have provided a lot of community partners that we currently have. And so I think just using them as resources, and Ed, Miss Tamika Henry, she has been valuable to our program. And even she's a part of this training that we do. She did a training video for our shared success rubric. And what we do there is we take some of our policy committee members and some of our board members, and they work strategically together to make sure that the program is hitting all of our standards and even beyond those standards. So as far as program involvement and community involvement.
And for the extended services department, I would say our community partners, definitely, as well, like what Diana said, especially for our in-kind donations, because of COVID, our in-kind was, we were able to get those waived, but now it's like we have to start working again for in-kind. So definitely our donations and trying to get those coming in, as well as working digitally to get those in-kind hours from our parents' side. So hopefully implementing continue our digital intake for in-kind.
And on the HR side is just continuing to support the staff. I think we started to do some things throughout the pandemic as far as emotional empowerment training. We're now going to continue that throughout this year, and just making sure that when they come to work, they're ready to work and be there for our families emotionally, as well as, physically, but just continuing to support them and also working towards getting everybody fully vaccinated.
And financially, I see a fairly large challenge ahead for Head Start programs. We have quite a few additional costs related to PPE, sanitizing, social distancing, and the protocols we have in place. But that supplemental funding will be drying up. So we'll have to incorporate those additional costs into our operating budget that we see today. So we'll have to find cost efficiencies elsewhere. One of those cost efficiencies, I think, definitely relates to the footprint that we have specific to administrative staff. Like I mentioned before, working from home more, I see an opportunity there, and also working more in our centers as opposed to maybe a headquarters type location.
And I would just add, a really big focus, and Shannon already mentioned it, but a really big focus on supporting our staff. One of the things that we've been doing as a leadership team since my time with Acelero is really focusing on emotional intelligence. And with that, we're not looking at just the emotional intelligence of the folks on our leadership team. We're looking at the emotional intelligence, which includes health and wellness for our staff. And so what can we do to help them out? We've done a number of things over the past year, including even doing financial literacy for our staff, which are not the highest paid, but how do you make the most of every dollar that you make? And so we're constantly looking at what else can we do for our staff. And for me, you know, I'm really looking at what can we do to increase the pay for our staff. Where can we find dollars from our budget to be able to pay, to raise the pay for our staff? It's really difficult to do, but at the same time, I'm trying to find that money somewhere so that we can pay our staff more. And I'm really looking forward to hoping that the Congress and the president will be able to get the president's proposal approved so that, you know, we can really have that extra dollar, those extra dollars from the federal government to be able to raise the pay of our staff. So that to me is probably one of the biggest things that I want to address as we come out of the pandemic. We got some emergency dollars to be able to raise our pay a little bit. I'm looking at, I would like to have a permanent solution for that. And so I'm really hoping that we can get that proposal from the president approved so that we can help our staff, which in turn means that they will be able to really focus on our children and our families, so, and have even greater outcomes in the future.
Excellent. Well, thank you. And that's a great place to end for today, at least. We're at the top of our hour. Whenever we work with the public as an association to explain or to support people's engagement with Head Start, we always say, if you're looking for where the power and the passion of Head Start is, it's in local programs. It's in the leadership of programs. It's in that determined culture to get the work done for children and families. And you all are such a wonderful example of that truth, that it's in the communities where the work is done, where the learning occurs, and where the leadership really forms. So thank you for your commitment to the program in your community and the impact your work will have outside of your community as well. So Dr. Maxwell, thanks for making everyone available today. I know there's a lot to get done, and this is a big piece of your day. I appreciate that, and we wish you well. And for all those who attended today, thanks for being attentive. And of course, this has been recorded and will be made available, and we'll be sharing that out on our YouTube channel so that others can listen in at their leisure, lift from the experiences that you've had, and learn and grow accordingly. So thanks. Have a great afternoon, everyone.
Thanks for the opportunity, Ed. We appreciate it.